What is our responsibility to our fellow citizens, both as individuals and as a society? Our faith traditions, every one of them, call on us to care for our neighbor, and in those traditions, healing is a sacred activity. Healthcare in the United States is in crisis. We have the most expensive, most complicated, and most inequitable healthcare system of any rich industrialized country in the world. Our current system not only leaves out the most vulnerable in our population, it also affects the middle class. 62% of bankruptcies and 50% of home foreclosures are the result of medical expenses. Healthcare costs are increasing at an unsustainable rate. Premiums and out-of-pocket costs are rising faster than workers' earnings, and individuals and families are being asked to shoulder more of their healthcare costs through policies with high deductibles and high copays. Still, over 10% of people remain uninsured, and millions are underinsured. They can't get the medical care they need because they can't afford the copays and deductibles. Why is this happening? One reason is the high cost of administration, which is rising at an alarming rate. Another is waste from inefficient care delivery, excessive prices, and fraud, which costs us billions each year. For-profit insurance companies are making huge profits, much larger than the stock market as a whole. Health insurance CEOs are among the most highly paid people in the country, many making well over $10 million a year. And as insurance company mergers increase, health insurance prices rise. Today, healthcare is a commodity, available to people who can afford to pay for it. Like some people live in a shack and drive an old clunker, and some people live in a mansion and drive a Mercedes. Shouldn't healthcare be more like the police, fire, and schools? We all pay because we all benefit. We shouldn't allow health insurance to create this problem in our country. We ought to fix this. Every other developed country in the world provides health insurance for all of their citizens, and at a much lower cost than we pay. And we can, too. We can do better. And we in Colorado have a way. The plan is called Colorado Care. Colorado Care, Amendment 69, will be on the Colorado ballot in 2016. It will provide quality, affordable health care for everybody in Colorado, and it will cost a lot less than we are spending now. There will be no copays for primary and preventative care visits and no deductibles. All Coloradoans will receive the health care they need. Colorado Care was developed in Colorado by healthcare professionals. The plan has been reviewed by financial and economic experts in Colorado and nationally. Colorado Care will include every doctor, hospital, physical therapist, all of the medical care providers that you need. With Colorado Care, it is the patient who will make the choice of what provider to see, not the insurance company. Colorado Care is simple. Every Colorado resident is covered with a high-quality plan that covers primary and specialty care, preventative and emergency care, hospitalization, prescriptions, as well as mental health and substance abuse, and some dental, hearing, vision, and nursing home care. Retired Coloradans will continue with their Medicare coverage, with Colorado Care providing the supplemental coverage. Medicaid recipients will have the same coverage as any other Coloradan, and providers will be paid the same for Medicaid patients as they are for any other Coloradan. In addition, copays for specialty care can be waived in hardship cases. People will not lose coverage if their financial situation improves just enough to put them over the Medicaid limit. Our healthcare providers will be well paid, so they will stay in Colorado. And because all patients covered by Colorado Care will have the same reimbursement schedule, providers will no longer have to close their practices to Medicaid patients. With Colorado Care, Colorado will be an attractive place for physicians to practice. We will pay for this plan with an entirely new way of financing health care. Gone are the premiums and high deductibles. The plan will be paid for with a payroll deduction. 3.33% of payroll for employees and 6.67% will be contributed by the employer. This payroll deduction will replace all of the premiums and deductibles you now pay, and most of the co-pays. For most people, this will be less than the premiums, deductibles, and co-pays you pay for the coverage you have now. Non-payroll and self-employed income will be taxed at 10%. For retired Coloradans, both the federal and state tax system allow deductibles for retirement income, which further reduces the premium tax for seniors. Additionally, the healthcare portion of workers' comp will be covered under Colorado Care. Colorado Care is a Colorado solution to a problem that is hurting our economy and our people. Governed by an elected board of trustees who will set policy and oversee the implementation of the plan. Colorado Care is good for Colorado business because it lets businesses focus on their core business and eliminates the high cost and uncertainty of providing health care for their employees. With Colorado Care, the healthcare system will be more efficient, waste and redundancy will be reduced, preventative healthcare practices will be encouraged, and drug prices can be lowered through competitive bidding. And Colorado Care will provide high-quality healthcare for all Coloradans, regardless of their age or financial situation. Colorado Care is endorsed by some of the most trusted organizations in Colorado. As always, how you vote is a private decision. Learn more, consider it carefully, and vote your conscience.